All right, so we are live. Hello, everyone. Welcome to YouTube channel HealthQ, the place where our mission is to motivate you and help you to move on to the brighter side of the health. I am your host, physiotherapist Meghna Dave, and with me today is physio Gayatri Suresh, who is a biomechanical expert physiotherapist in our platform. So, in today's video, we are going to talk a lot about what is biomechanics. You must only know the one side of physiotherapy, and that is, we apply machines and we give you exercises, but there is a lot of science behind it. And what is that science? And that science is called as biomechanics. We are going to talk about that. What exactly a biomechanist do? How posture analysis, gait analysis are a very important part of assessment in physiotherapy, and how this helps you to work towards your recovery. If you suffer from chronic pain or any kind of musculoskeletal ailments, this type of analysis can be very helpful for you. So that is what we are going to talk about. So without wasting any due time, let's get started and welcome Dr. Gayatri
Hello.
into the session.
Yeah,
So
thank you for
it's
having me here.
yeah, it's a great pleasure to have you as well. And I think it's one of the most awaited session for me because
Okay.
biomechanics is a science, or you can say it's a field which is not much talked about. So it's
Yeah.
very interesting. And since you are a master's in biomechanics, learning
Yeah.
from you also would be such an insightful thing for me and other audience as well. So let's get started with your introduction itself. So can you please introduce yourself to our audience so they can understand who you are, where you're coming from, everything.
Yeah. So, hello everyone. I'm Gayatri Suresh and a physiotherapist. I did my Bachelor of Physiotherapy from Pune, and then I wanted to do something different. We see a lot of people who are sports physiotherapists. We see a lot of orthopedic, cardiorespiratory, neurological. But I was thinking that maybe there is something that is further required in the field of physiotherapy. So because of this, I got my interest in studying a subject called biomechanics, in which is a part of physiotherapy, but not as much studied in India. So biomechanics tells you how movement happens. So if you're looking up or down, is it because of the muscles? Is it because of the bones move each other? Is it because of ligament tension which lets you do that movement or restricts that movement? So this is something that I felt was something very interesting, and therefore I did my specialization in biomechanics. And I use a lot of these biomechanical principles to tackle people who are coming to me with pain. So, yeah.
Awesome. Awesome. So how different is this biomechanical way of helping a patient from a regular or else conventional physiotherapy method?
I think biomechanics helps you go deeper into what may be the issue with the patient. So you see not only the muscles or the bones, but you may also see, the forces that are acting on them. How much force the person's body is able to take. If they're having pain or if they're having injury, is it because the body is not able to tolerate something like this? Is it because some structures are under more tension, or the person's doing much more than what their current capacity? So I think getting that insight, it really helps in creating a very customized, tailored rehabilitation program. Rather than if someone comes to me with pain and I give them a gentle strengthening, that's kind of assessment of what their body's capacity is, of how the external and internal factors are influencing. So I think having a biomechanical assessment along with the regular, it's a part of orthopedic and neurological. I won't say it's something very different, but it definitely helps me at least go a little deeper into what can be a patient's problem.
Right, right. So, what the study involves? Because I think a lot of people again don't know what are the studies that is involved in physiotherapy profession, or it's when we are training ourselves into physiotherapy. So, if you can just put
Right.
a small light on that, what is the course like? What you guys do when you are going through your master's program on biomechanics?
Yeah. So if any of the physiotherapists are watching here, you have learned about what is posture analysis, what is gait analysis. But how are we taught that in college? We use a plumb line and we are asked to see if if the line is centered to our body, then the person has a good posture. But if the body is aligned out of the center, the posture is not well. That's a very basic of what we are taught. Then if you're taught how to analyze walking, it's most of the time a chalk powder experiment where people are dipping their feet in chalk and then they are walking, and then you have to see how long or how short the step is. But what is missed out on this is you don't know what is causing it. So if there is a thing out of the center, So let's say the head is tilted to the left or right. Is it normal for that person? Because it's very unrealistic to believe that everybody on this planet can have the same posture. There are people born with different anatomy. So what we call a normal feet for someone, and another person is having flat feet. The flat feet can be normal for that person. It's not like it may be pathological. If someone is having a flat back or a very large curve on their back, for their anatomy, it may be normal. So if they're having pain, we may have to see other aspects of pain. Same with gait analysis, walking analysis. If you're finding that someone's not putting heel first while walking, is it a normal or abnormal thing? Or if it's an abnormal thing, then what kind of muscles are being used or compensated? How is the ground acting on us? How is the atmospheric pressure acting on us? How our body is compensating for this? I think this is something much more in detail that we learn during the masters in biomechanics. So it's like knowing the anatomy and the muscle functions is something much what we go into a very deeper level. And we get to know about the different softwares that we can use in physiotherapy, because biomechanical analysis is not something we can do with our eyes. You definitely need a more inside data to see exactly what is happening within the body. So in this course, you learn how to use softwares, you learn how to place markers on different parts of the body. You see how to do a 3D analysis as well. So this gives you a perspective rather than just a visual observation, because visual observation is the least reliable. What we see may not be the problem.
Right, right. So, for the general audience or people who are patients, I'd just like to give you a little bit brief about. See, physiotherapy, or we as a physiotherapist go through a 4 year course. Okay, this is done after the medical entrance exam is given. After this 4 year course, we do our masters or else our specialization in a program. Now, these specialization are in different fields. One of the fields where I have done is my neuro rehabilitation or neurosciences. Very similarly, Dr. Gayatri comes from the field of biomechanics. Okay, so biomechanics is a way through which a physics of the body can be understood in a very simple form. Right now, why this physics is important to know? Because most of our muscles, right, are having a lot of physical properties. Okay, as the physics is the name, so muscles have physical property. There could be damage, or else there could be an alteration in these physical properties due to damage, disease, degeneration, etc. So as a physiotherapist, we need to identify these mechanical issues, and we need to fix them with the methods like exercises or pain modalities or maybe posture correction, etc. Right, and that's where biomechanics as a field comes into a picture, where there is use of different softwares are being done to do an analysis of the whole body to figure out, is there any deviation, is there any imbalance, that one side of body is too tight, one side of body is too weak. So there is some imbalance that is usually seen in people, especially who are experiencing pain. Right, so that's what is being done when a person goes through the learning or understanding of biomechanics altogether. Now, having said that, that takes me to the next question, and that is why there is so much imbalances seen in people with chronic issues or chronic pain over the people who have maybe a temporary issue. What exactly changes from your experience?
So for this question, I'll just define to people what acute pain is and how it can go into chronic pain. So I think most of the people would have experienced what an ankle sprain feels like. You know, you suddenly twist your ankle, and there's a lot of pain. You can't walk for a while. You can't kneel on the floor. So when the ankle is suddenly twisting, the body is sending a signal that, oh, this part is injured, you need to give it rest. So even if someone tries to kneel or try to play football with an ankle pain, they can't. The body will just give the person so much pain that it will not allow the person to do anything. So here pain starts as a very protective mechanism, including inflammation. Why the part gets swollen is to get enough blood to that part to start healing. Now, a regular ankle sprain's pain is supposed to go down within some 2 to 3 weeks, and the entire ankle sprain is supposed to heal within 6 to 7 months. But what happens is, in these 2 weeks, the brain is continuously thinking that you're not supposed to move your ankle because it's a painful thing. But well, as the pain starts staying longer than it's used to, it's because the brain has not come back to the thought that, okay, now the part is okay, now you can move it. The brain has not started perceiving that. So here the pain starts getting chronic. And then the person, because they feel like, oh, I had an ankle sprain 3 months ago, 4 months ago, but it's still hurting. I think I should still not move. I should still not use it. So they start putting all their weight on their left or any the normal foot, or they start not putting using that part much. And like we see, if you stop using something or if you start using something less, the size of that part reduces, the functionality of that part reduces. So in humans are not machines where if something goes wrong it will stay wrong. So in humans, if we don't use our parts, our body parts, then the functionality goes away. So when in patients with chronic pain, it's very important for not, because the tissue is fine now. After 3 to 4 months, your tissue is fine. The original injury is gone. So in chronic pain, you're supposed to retrain your brain that it is okay to start using that part now. It's not a painful movement anymore. And I think that's where biomechanics comes into picture, where you start training the movement back. You remove all the factors that is restricting that movement. That's what
All
you
right.
want to do. Yeah.
Yes, awesome. And coming back to again the next question on posture analysis itself, what exactly can be identified through posture analysis, which usually gets missed out? When a therapist is just seeing a patient from the eyes, what is that difference that gets identified?
So for this, I'll just divide posture into 2 to 3 components. One is the your own anatomy, how your body is built from the time you are born. Again, I said there cannot be one single posture for everybody on this planet. Everybody is born with different body structures, and that's what makes humans very unique. We're not meant to be the same. So the way you're born, the way your body structures are aligned, that is your posture. Second part is your adapted posture. How you sit, how you stand. Do you prefer sitting little relaxed? Do you prefer sitting erect? Is anything comfortable for you? And third part to posture is when the body compensates for pain. So there is something known as a spinal list, where in one side of the body, if it's painful, the body will shift itself to one side to remove that pressure on that side. So there is your posture, there is your preferred posture, and then there is the posture that your body attains because of pain. Now, why we need a certain analysis? If I tell you that this is the normal arch of the foot, sorry, yeah, if this is a normal arch of the foot, it's what I see. But if you come with me with slightly less, is it abnormal or is it still within the normal ranges? Is it flat? I cannot see if I see it visually. I need to know exactly how many degrees it is to be able to call it a normal, or even a flat feet is normal, but to see if it's a neutral arch or if it's flat. Same way with the curve of the back, you need an X-ray and marking of the angles to know exactly how much at an angle your back is. I cannot do this visually. Maybe your skin is too thick. Maybe you're wearing clothes. Maybe you've changed your angle in some way or rotated. So if I just ask a patient to stand and I'm looking, I really cannot identify a lot of factors. So it'll be useful for me to place markers on specific points, take a picture because I have the data later also. If I see it once, I cannot have that memory in my head for a long time. So I can have the data, I can analyze it, or I can go deeper as I want. So this is where the use of softwares, the use of some X-rays. I wouldn't advise an X-ray for posture because most of the time posture is not that serious to cause pain. But I would definitely advise people to go for postural analysis with markers, with softwares to get a better idea. Because visual posture analysis is one of the most unreliable things that people can do.
Right, right. So, how does that entire posture analysis process looks like? What you do when a patient, when you get a patient, or as a patient comes to you with pain, and you have to first do this posture analysis? What it looks like? What is the process?
So there is a difference between what pain is and what nociception is. If someone pricks their finger or you suddenly keep your hand over fire, that gives you an experience that makes you want to withdraw. That process is done through your pain nerves, which can give the brain a signal that this is something which is definitely damaging the tissue. That is nociception. But pain is a whole other experience. It involves your body, it involves what your brain thinks about your body, and it also involves your surrounding factors. Let's say you had too much stress at your job one day, or you had a fight at home one day, or you're just feeling low for some reason, that can increase your pain experience. Or if you've just had an injury, that can cause pain in that 1 or 2 weeks initially. Or any your environment, you're working in a very hard chair, you're sleeping on a very hard mattress, that can also cause pain. So one is to identify what is causing pain, or it identify what all stresses are causing pain because pain is not usually caused by just one thing. Second, if the posture is a cause of pain, I would first do a static posture to see if, by static, I mean if you're standing or sitting in one place where you're not moving. I would want to see if there are any changes. Like I said, if a trunk is shifted, because to avoid compression on one area, I would see if there are some changes like that. If a static posture seems fine, the person does not have any process, then I would go in for a dynamic posture to see if someone is having shoulder pain, are some movements hurting them. I would still place markers, ask the person to do that painful movement, and see how the body is compensating or the body is working. Or if someone is having back pain and bending and lifting in something is painful for them, then I would see how if the body is stopping at some place or compensating in some place. So it would go, ideally, if someone is coming for a posture analysis, I would ask the patient's history of what happened, how it happened. Then I would go for a static analysis where the patient is not doing anything but is sitting or standing in one position. Then, more important than that is the dynamic to see how movements are happening, because in the everyday we move, we don't just sit in one place. And then, whatever the patient wants. If the patient wants to go and bend and lift something but is currently having pain, then I'll give exercises accordingly. If bending is painful but the patient does not have any need to bend, then I will change the exercises accordingly. So that's how I would go about posture analysis for a patient.
All right. And how about in the situation of neurological disorder? Let's say some patient is having a stroke or is a paralysis on one side of the body, or let's say there is a spinal cord injury and the legs are paralyzed. In
Right.
those scenarios, how posture analysis or maybe a movement analysis or gait analysis can help?
Mhm. Yeah, that is one. I think that's a very good question. So, how the body maintains its posture is through the central nervous system. So, it is not only your muscles, it's not only how you want to sit, it's all being regulated by your brain and your spinal cord. So, the brain and the spinal cord gets information from your muscles. Let's say you've been sitting for too long, the muscles feel like they're being cramped. They'll send a signal and you'll want to, stand up, stretch, and all that. Second, the brain will receive signals from your sensory system. If someone tells you sit up straight, then your brain says, okay, I need to change my posture. Or if someone says, oh, bend down and get me that ball, then the brain will do that. So it's the central nervous system that gets all of this information. Now, in cases of paralysis and spinal cord injury, let's take spinal cord injury, for example. If everything below the stomach is paralyzed, so the brain is not getting information from the muscles because they are not working anymore. So it will start going into compensation. If I have to give the viewers here an example, if you sit up completely straight, is there a chance of you falling forward or you falling backward if the muscles are like if the muscles lose control? Most of the time, it's because of you falling forward, because that's where the forces are acting. Even if you try falling backward right now, you really can't, because that's not where the forces are acting. But in spinal cord injury, when the muscles are paralyzed, the people can very easily fall forward. So what do? They shift all their weight back. That is one postural compensation that the brain does to ensure that the person doesn't keep on falling here and there. Same way, if someone is one side paralysis, the brain will start making them sway on the other side so they don't fall on the same side. So, in this case, you may start seeing a scoliosis like pattern, but as a physiotherapist, we should know not to correct this, because then we are doing more harm to the patient than good. If a spinal cord injury person is sitting with complete rounded back, it is for their own balance and stability. But if they're having pain with that, then you can try getting them little straight. So that's how posture can help with neurological conditions, but it is also completely up to the physiotherapist or occupational therapist's clinical reasoning as to what to do with that postural deviation.
Right. So on that note, I'll just take a pause because we have got one question from the audience. Anji is asking,
Mhm.
"Hello, ma'am. My right arm and right leg feel more sensation. Despite that, all my reports and MRI are fine. So, is there anything from a posture analysis perspective? Would you like to add on this part?"
Mhm. If it's something to do with sensation, if you're feeling numbness or you don't feel one arm, or if you're feeling something extra, I would definitely want to do a posture analysis to see if there is some sort of compression. Because anything that's to do with sensation, or whether it's excess sensation or reduced sensation, would indicate some sort of nerve irritation or nerve compression. So I would do a static analysis, a dynamic analysis, and if I find anything from that, then yeah, we can go into a rehab program. Otherwise, you can go in for a little more deeper thing like an X-ray or an MRI. If it's that severe, obviously, I don't know you right now, whoever's asking the question. So this is what I would do if it's something severe or something very mild.
Right. So, all right, Anji, I hope we were able to answer your question. You can reach out more for with more details to us. I'll write our website and the email ID here in the comment box, so that you can just send us your entire details so that we can help you out further. All right, so that takes me to the next question of the session. So now, since we know, okay, what all what all is done in posture
Mhm.
analysis, how the posture analysis done can be done. What are the common conditions or problems, according to you, uh, require posture analysis for sure? Or else you can say it would be more helpful to do posture analysis in what all
Right.
conditions.
Right. So before I say that, definitely one place to not do posture analysis is if you have pain. Most of the time, posture is not a cause of pain. Posture may be a consequence of the pain, but it's not that if you have a very stiff back or a straight back that is causing your pain. So for all the patients out there, think about going to a clinician who can tell you exactly how to work on it. Because all through all recent research, posture is definitely not a cause of pain. Where it is actually useful is in conditions in where there is progressive deviation in posture. So when you have scoliosis, am I audible, visible? Yeah. So when you have scoliosis, scoliosis is a lateral or a curve of the spine. The spine is ideally supposed to be straight, but when there's a curve in the spine, that is sometimes not optimal. So if someone is having that curve, but it is going on increasing, then it's a good idea to do regular posture analysis to see to what extent it is increasing. That is one thing. Then there's another condition called ankylosing spondylosis, where the spine progressively starts getting weak. Am I audible, Meghna ma'am?
Yeah, now you're audible. It got disconnected.
Okay, okay. When what was the last thing that you
Yeah,
heard?
we were talking about in what all conditions we need posture analysis. So you were talking about like most of the research have shown that posture is not the cause of pain.
Yeah. So where, and I think this stumps a lot of people because I've seen a lot of patients come to me, and when I ask them like, why do you have pain? They'll say something that the doctor said. Oh, I have pain because my shoulders are forward. I have pain because my feet are flat. So that is one thing I have to make patients unlearn that most of the time it's not because of that. Now, where posture analysis will be useful is in conditions in which abnormal posture is increasing over time. So, in conditions like scoliosis, scoliosis is where you have a curved spine. The spine is ideally supposed to be in a straight alignment, but there are some people who developed a curvature. Now, if this curvature is increasing with age, it can definitely cause issues in breathing. It can cause some sort of compression, some sort of pain. So, if I come to know that it is not a curvature that is stopped, but it is increasing, then I would want to do a regular posture analysis to see, let's say, after every 6 months, after every 1 year, how much it is increasing. Second condition is something known as ankylosing spondylosis, again, in which the posture is going to continuously get worse. So, from a very flexible spine, which can bend, extend, the spine is going to start getting stiff and straight. So, at what rate is it getting stiff? Or how much time is it taking? How is it affecting the patient's overall activities? I would want to do a posture analysis. Second, if someone's job requires them to have an erect or confident posture, something like modeling, something like bodybuilding, where their job depends on how their body structure is. That is again a place where I would want to do a posture analysis and see how to work on even the tiniest muscle balances. And third thing, in case I want to prescribe someone some assistive device or some orthotics or some amputee, for example, a prosthetic. If someone who has an amputation below the knee but has a 5 bend in the knee, I would want to straighten it because that is not going to help them walk easily. So I would do a posture analysis, see where the knee and all is deviating, and give them a prosthesis with that 5-degree bend. Or if someone is having a trunk shift, for example, I would do a posture analysis first and then give them a brace which can correct that. So these are only the three parts where a posture analysis is actually useful.
All right. Okay, so one more question, and that is around fibromyalgia.
Okay.
Conditions like fibromyalgia, where a patient is not having posture related issues, the pain is coming from a different set of area, but is impacting posture. So, is there a possibility that posture analysis can help identify the source of imbalance and can help that person to get work, like to work on it? Anything on that you would like to say?
Unless someone is only using one side of the body and not using the other side at all, in these cases, I would not recommend a posture analysis because most of us we don't go to an extent that you're using only one side. You're completely strengthening one side, doing all your movements and not using the other. So usually, regular individuals who don't have any neurological conditions don't come with a lot of muscle imbalances. So in people with fibromyalgia, I wouldn't focus on their posture as such, but I would focus on them being mobile because, or by mobile, I mean for them to keep on moving. So they should not go to a stage where they get bedridden because that will worsen the condition more than anything. Because the minute humans stop moving or we stop doing our activities, it's not going to benefit us in any way. So these are the kind of patients where posture analysis really wouldn't be useful. Rather than that,
Ah,
movement would be useful.
all right. And how about a relaxed posture or is a slouched posture? In that, is there a role for posture analysis?
No, because relaxed and slouch postures are completely okay. The one time where you that can affect you is if you're maintaining that for very long. I know
Yeah.
many people come across a lot of things where if you sit like this, there's less oxygen to the brain, there is more stress on the back, there is tightness of the hamstrings. But none of these posts mention how long. If you're sitting in a very relaxed position for 5 minutes, it's really not going to cause a lot of issues. Even if you sit for 1 hour, it's not going to cause a lot of issues. But if
Right.
even yeah, but if you're going and going to sit like that for 7 hours, 8 hours, that is when the problem comes in. And this problem also comes if you're sitting straight. So people say that erect posture is a straight posture, but is sitting completely straight for 3, 4 hours is good for your body? That is also
Right.
not good for your body. So no matter what position you're comfortable in, be in that position. Ensure to change every 45 minutes to 1 hour, and you should be fine. So you don't have to keep on sitting straight the entire day. You don't have to keep on slouching also the entire day.
Right. 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 All right. Thank you so much for these questions which were there from the audience. Let's move on to the next question. That's from me again. And that is how long a posture analysis session lasts? What all things are done in that? And what are the key outputs that a patient can get after this posture analysis?
Yeah. So starting from what is the issue that the patient is facing up to the end of the posture analysis session, it takes around 30 to 40 minutes because for posture, like I said, it's very hard to do it visually. So, as much as possible, the patient has to first of all be undressed as much as possible and as much as they are comfortable. Then, second, we have to be able to place some markers. Markers are placed on some points of the body which can help me analyze the levels or the deviations and all. Because for some people, the shoulder can be here and the other shoulder can be down here, but I may not
Yeah.
be able to look at it visually. So after getting a history which takes around 10 to 15 minutes, I would explain to the patient what they can expect out of a posture analysis and what they have to do, and only with their consent of how much they should undress or how they should be standing. Then I would instruct them that I'll be putting you in these positions. Be in that position like you would in your house. So don't be very stiff. Don't try to change your position now. And then I would place markers. So based on my knowledge of anatomy and that person's anatomy. So I would place markers on some points. So things like both the ears, both the shoulders, then one the hard spine that you feel in your neck there, then your hip bone, on the knees, when then in the front of the body, on the kneecaps, and at the ankle. And then from the back, I'd put it at the calf and at the heel. So these are the basic places where I would place markers. Then I would take picture of the person. So front view, side view, back view, and by side view, both views. And then this That's it for that session. I would tell, because I use softwares, I cannot generate the report in that very session. It would be done by the next day. So I upload these pictures to a software. The software connects all these dots and shows me exactly how many degrees is off or how many degrees is okay. It even shows me if there is, let's say, someone's shoulder is slightly tilted, how much of a tilt is normal, how much of a tilt is acceptable, because we can't expect everyone to have like similar shoulders. Then coming to the dynamic analysis, this is static analysis where I ask you to stand or maintain one position. In dynamic analysis, this is definitely a little more time consuming. Again, the
Mhm.
markers are placed and ask you to perform a movement. Let's say if someone is a cricketer is coming to me with shoulder injury, I ask them to perform their bowling action, which is otherwise painful. Then, as a biomechanist, I'm supposed to know the phases of bowling. You know, the phase where the hand goes up, then forward, then the ball release. Then I would analyze the posture, shoulder posture in each of these phases and see if there's some compensation happening, see if the some muscle is overacting, underacting, and things like that. So you can expect, if you're coming to me for a posture analysis, anywhere
Mhm.
between 20 to 40 minutes based on your history, the whole posture
Mhm.
analysis session, and a discussion with you about what you want.
Mhm.
Even if I feel that there's a posture which is not what you call optimal, but the
Mhm.
patient is not having issue, then I really wouldn't go and correct it. I would work based on the patient's goals. Yeah.
Awesome. And that makes me curious to understand about pediatric conditions or as kids. In what all situation kids can be helped through posture analysis?
Yeah, so if the kids are completing their milestones at the correct age according to the guidelines, then I don't think there is a need for posture analysis. But if a kid starts showing, and we should know that the kids are already born with an excessive arch in their back, they're born with flat feet because that's how the body is when you're thinking. Because the kid's head is heavier, their back has to arch to keep them stable. So this is a normal posture which starts changing as the kid starts growing older. But if the kid is not following these milestones, if they are not able to walk with their heels on the ground, if they're walking with their toes up, or even after the age of 3 and 4, their back is excessively arched, indicating that they need some sort of balance and stability, I would go
Right.
for a posture analysis. But in case of kids, they cannot tell us about pain or by kids I mean very young, obviously. So 8 or 9 year would be able to, but a kid as young as 3 and 4 with a posture analysis, I would refer that kid for a neurologist or a pediatrician or a pediatric orthopedist because again, posture is indicating that something else is wrong. So in those cases, I would do an analysis for a kid where it would be useful for them.
Awesome, awesome. All right. I think these were some of the very insightful answers that you gave. Just to give or else just end this session here, I would like to ask again if patient or anyone who wants to reach out to you or get some posture analysis to be done from you, how they can reach out to you.
Yes, I'm definitely one of the people on the consultant panel of HealthQ Rehab. So anyone who wants any help with their posture or any help with their movement, not just posture. If you're facing any issues with moving and you want to get back to your sport or walk properly, you can find me on HealthQ Rehab and you can contact me directly or you can contact Meghna ma'am directly and you can definitely connect with me. And I work online. So online can also, like, it's not like online is any uh, how do I say this? Like, it's not like coming in person is better than online. So online therapy can also help a lot. And I will be assessing you as per what I told you right now. You can find me on
Awesome.
HealthQ Rehab. Yeah.
Awesome. That was so amazing session, Dr. Gayatri. Thank you so much for giving your time, sharing your insights, sharing your knowledge with all our audience. Audience, if you have got any question, I have put the email ID in the comment section. So feel free to reach out. Anji, especially you, since you had shared your problem to us, please write to us so that we can help you further. We will try our best to help you out in identifying from where these problems are arising and what can be done about it. On that note, we will end this live session here and see you another week with another live video session. Any parting message that you would like to give to the audience, Dr. Gayatri?
Yes, I think thank you very much for having this session because there is a lot of misconception around posture in the general public. People keep on like hearing things like, you should sit straight, you should not do this, you should not bend like that. But most of them are myths. So this, I think, would be a very much awareness session for the general public. So thank you for hosting this. And again, if anybody wants a consultation on any of this, you can reach out in the email ID or directly on the HealthQ website.
Yeah. All right.
Yeah.
Okay, guys. Thank you so much. See you next week. Bye-bye.
Bye.
Bye.